3 things you must do daily for strong, pain-free feet after 50. Have you ever stopped to think about how much your feet do for you? Every step, every movement, every adventure, they carry you through life. But as we age, foot pain, stiffness, and balance issues start creeping in, turning simple activities into daily struggles. What if I told you that just 3 simple exercises could change that? In today's video, I'll show you 3 powerful yet easy foot exercises that can help prevent and even fix common foot problems, keeping you steady, strong, and pain-free. These aren't just stretches, they're the foundation for better mobility, balance, and lifelong foot health. But before we dive in, remember, not every exercise is suitable for everyone. If you feel pain, listen to your body and skip anything that doesn't feel right. Ready to unlock healthier feet? Let's get started. Exercise 1, Towel Scrunch. The simple trick to stronger, healthier feet. Imagine walking across a smooth, sandy beach. With every step, your toes naturally grip and release the soft grains beneath you, strengthening the tiny but powerful muscles in your feet. Now, what if I told you that you could recreate that same natural strengthening movement right in your living room without the sand? That's exactly what the towel scrunch exercise does. Why this exercise is a game changer. Most people don't realize how much they rely on their feet until problems arise. Weak foot muscles lead to poor balance, increased risk of falls, and even issues like plantar fasciitis or flat feet. The towel scrunch directly targets the foot flexors, the muscles responsible for gripping, stabilizing, and propelling you forward. Strengthening these muscles improves balance, enhances mobility, and keeps your feet resilient against common age-related issues. How to perform the towel scrunch exercise. Setup: place a small towel flat on the floor in front of you. Sit comfortably in a chair with both feet resting on the ground. Positioning: keep your heel firmly planted on the carpet, and place your toes and the ball of your foot on the towel. The movement: using only your toes. Begin pulling the towel toward you by scrunching and gripping it with each toe movement. Your heel should stay grounded the entire time. Repetition: continue until you've gathered as much of the towel as possible. Then, reset and repeat for about 2 to 3 minutes daily. The science behind the movement. When you perform the towel scrunch, you engage the intrinsic foot muscles, the small but crucial muscles that provide arch support and foot stability. This exercise mimics the natural gripping motion we often lose from wearing stiff shoes or walking on flat surfaces. It also helps improve proprioception, your body's ability to sense its position in space, leading to better balance and reduced fall risk. Who benefits most from this exercise? Seniors looking to improve balance and prevent falls. People with flat feet who need to strengthen their arch support. Anyone recovering from foot injuries like plantar fasciitis or Achilles tendon issues. Athletes and active individuals who want to improve foot strength for better performance. Make it even more effective. Try it standing, once you've mastered the seated version. Challenge yourself by doing it while standing. This increases the intensity and makes it more functional. Use different towel textures. A thicker towel adds resistance, making your muscles work harder. Add a weight. Place a light object, like a small book, on the end of the towel for extra challenge. The real-world impact. Think about your daily activities: walking on uneven sidewalks, stepping out of bed in the morning, or simply standing while cooking. Every movement depends on your foot stability. By dedicating just a few minutes each day to the towel scrunch, you're investing in years of pain-free movement, better posture, and a reduced risk of foot-related issues. It's simple, effective, and requires nothing but a towel and your own determination. So why not start today? Exercise 2, Big Toe Extension. Unlocking the power of your most important toe. Every step you take. Every time you push off the ground. One tiny but mighty part of your body is doing most of the work, your big toe. It's not just there to help balance your foot, it's responsible for nearly 80% of the stability and force generation in walking, running, and even standing. Now, here's the problem: as we age, many of us lose mobility in the big toe without even realizing it. Stiffness creeps in, making each step less efficient. Over time, this leads to compensations that put stress on the knees, hips, and lower back. Ever wondered why some people shuffle when they walk or struggle to push off the ground? A weak, immobile big toe is often the hidden culprit. Why the big toe extension is a must-do exercise. If your big toe can't lift properly, your entire walking pattern changes. Instead of rolling smoothly through each step, your foot stays stiff, forcing extra strain onto the ankles, knees, and even the lower back. The big toe extension exercise helps restore strength, flexibility, and neuromuscular control, making every step feel smoother and more natural. How to perform the big toe extension exercise. Start in a seated position with your feet flat on the floor. Keep your heel and 4 smaller toes firmly planted. Isolate your big toe. Lift just your big toe as high as possible while keeping the other 4 toes down. Hold for a second. Then slowly lower back down. Repeat 10 times on each foot. 3 times a day. This may sound easy, but don't be surprised if your brain struggles to connect with your big toe at first. Many people find it nearly impossible to move the big toe independently because they've lost the neuromuscular connection over time. But with practice, your brain will quickly relearn this skill, and you'll regain control. Why this exercise is more challenging than it seems. Most people can't lift their big toe without their smaller toes coming up too. That's because years of wearing tight, restrictive shoes have weakened the small stabilizing muscles of the foot. This exercise retrains your foot to work the way it was designed: strong, stable, and responsive. Taking it to the next level. Progress to a standing position. Once you've mastered the seated version, try it while standing. This better mimics real-world movements and engages your entire foot and lower leg. Make it a dynamic drill instead of just lifting your big toe. Try holding it up while shifting your weight from side to side. This strengthens your foot's ability to adapt to uneven surfaces, a key skill in preventing falls. Combine it with balance work. Stand on one foot and lift your big toe while maintaining balance. This enhances stability and prepares your feet for real-life movements. Who needs this exercise the most? Anyone with stiff feet or poor balance. People who suffer from knee or hip pain. Weak toe mobility often leads to compensations higher up the chain. Runners and walkers looking to improve their stride efficiency. Older adults who want to prevent falls and improve mobility. The hidden benefits you didn't expect. What starts as a simple toe movement trains your entire foot and nervous system. After a few weeks, you'll notice better push-off when walking, no more dragging or shuffling steps. Stronger foot muscles, reducing the risk of plantar fasciitis and bunions. Improved balance, making everyday activities feel easier and safer. If your big toe isn't working properly, your entire body has to compensate, and that often leads to pain and stiffness in places you wouldn't expect, like your knees, hips, and lower back. This simple but powerful exercise helps restore natural movement, keeping you strong, mobile, and pain-free. Start today, and watch your entire body thank you for it. Exercise 3, the calf stretch, a simple fix for foot pain and mobility. If you've ever woken up with tight, stiff feet or felt a dull ache in your heels after standing too long, your calves might be the hidden culprit. The muscles in the back of your lower leg are directly connected to the health and function of your feet. When they become tight, they tug on your heel bone, increasing stress on the plantar fascia, the thick band of tissue under your foot, the nerves in your forefoot, and even your Achilles tendon. The result? Plantar fasciitis, Morton's neuroma, Achilles tendon pain, and even knee issues. Your feet are more than just a means of getting from one place to another, they are your foundation for an active, independent life. By adding these 3 simple exercises into your daily routine, you're not just improving foot strength, you're investing in better balance, smoother movement, and fewer aches and pains as you age. But remember, consistency is key. Just a few minutes each day can mean the difference between stiff, aching feet and feeling light, strong, and steady. If you found these exercises helpful, let me know in the comments. And if you're looking for even more ways to improve your mobility and overall health, make sure to subscribe and check out the links below for more exclusive content. Until next time, take care of your feet, they'll take care of you.